Would you prefer a can of beer today or a bottle of champagne in 1 week? How can some people resist the attraction of short-term pleasures and pursue long-term goals, while others easily succumb and compromise their ultimate expectations? Most studies implemented binary choices derived from behavioral economic paradigms. In these studies, neural data suggested that recruitment of the dorsal prefrontal cortex is crucial to resist the attraction of immediate rewards. However, paradigms employing monetary rewards may miss some essential processes that crucially determine intertemporal choices in everyday life. When imagining future situations might help in providing a motivation that counters the attraction of immediate pleasures. Imagining future situations involves recomposing elements stored in episodic memory, and hence recruiting the medial temporal lobe regions, with the hippocampus as a key component. The aim of the present study was to uncover the role of the hippocampus in the conflict between tangible and simulated options, which has been argued to represent the most typical case of intertemporal choice we have to make in everyday life. In this goal, a novel paradigm has been developed to assess the impact of hippocampus structure and function on the propensity to favor imagined outcomes in the context of intertemporal choices. An ecological condition imposed immediate options presented as pictures and thus directly observable through vision to delayed options presented as text and thus requiring mental stimulation. To avoid confounding simulation process with delay discounting, this ecological condition has been compared to control conditions, using the same temporal labels while keeping constant the presentation mode. In a first experiment, it was tested if the quality of simulation enhanced the values assigned to textually described options. Consistently, subjects were significantly more prone to favor the delayed option when it was simulated with higher richness. The same relation was observed across subjects. Participants who reported having imagined more details gave higher ratings to simulated options. This experiment therefore confirmed that simulation richness is a crucial factor in the ability to favor delay options when opposed to directly observable options. Then functional MRI has been used to analyze neural activity elicited by option presentation and choice response. We searched for regions that would be specifically recruited for non-impulsive choices. The analysis of brain activity suggests that the left hippocampus is specifically involved in choosing delayed options when they need to be simulated. This confirmed that the left hippocampus was specifically engaged when subjects made non-impulsive choices in the ecological trials. This is in line with the hypothesis that hippocampus activity is proportional to simulation richness and therefore to the value of simulated options. Using structural MRI, it was next examined whether inter-individual differences in brain structure could account for the propensity to favor non-impulsive options. It has been found a significant cluster in the left hippocampus where gray matter density was more correlated with functional contrast in the ecological than in the control condition. Analysis confirmed that intersubject correlation between gray matter density and functional activation was significantly positive in the ecological condition. Thus, gray matter density in the left hippocampus accounted for both the individual propensity to favor delayed options and the related hippocampus activation. To assess whether intact hippocampus is necessary for preventing choice impulsivity, the performance of Alzheimer's disease patients has been compared to that of patients with frontotemporal dementia and elderly controls. The key test was the comparison of non-impulsive choice rate between the ecological condition and the control condition. Alzheimer's disease patients were significantly more impulsive in the ecological condition than control subjects or frontotemporal dementia patients. In order to confirm the specific deficit observed in Alzheimer's disease patients, the task has been modified and adapted to elderly patients. Results show that Alzheimer's disease patients made more impulsive choices than healthy controls, and this difference was driven by the ecological condition. Thus, these results suggest that damage to the hippocampus had an impact on intertemporal choices, since future options that needed mental simulation were no longer favored.